Hi, and welcome to our first content series of the Rainbow Pharmacist. And we're here with none other than Joyce McSwan, who is probably Australia's #1 trendsetter in pharmacy, voted by her peers, and persistent pain extraordinaire. So, Joyce, how did you get involved in pain?
Well, I actually have a very personal experience with pain. I don't talk about it that often, but I grew up with a mother who actually suffered pain for all her life. And it really was very curious of me to sort of understand how she managed, all her life as well. And I've had my own pain experience consequently as well. So I think all the personal experiences culminate to, just having a very deep understanding of pain. And then as a pharmacist, seeing how we were treating pain and how that was so different to how I knew to manage pain and live pain. So there was this sort of mismatch. And so it just started my own curiosity to study it even more. And then a few, Pandora boxes opened. And then I realised that I knew something that my peers didn't.
Yep.
And that they needed to understand the real science of pain. So it all, went gangbusters after that. Yeah.
So when you're talking about the change in treatment of persistent pain, how has the science sort of changed, and what kind of information would you have for health consumers and pharmacists out there?
So we've gone from a very symptomatic way of treating pain. Pain was always seen as a symptom. Something goes wrong, you fix it. If you don't, you put a Band-Aid on it. If you're not, you put a bigger Band-Aid on it. It was just Band-Aid driven pretty much. And that's not a fault of anybody. It's just what we knew to do. Unfortunately, it didn't work. Pain got worse actually, life reduced. So what we were trying to sort out or fix, just that wasn't the way. So as with anything, you go back to the drawing board and you ask why, and you ask, is this the right way of doing it? And certainly, obviously, science asked that question and then realised that no, that's not sustainable. And so it became very obvious over time that we needed to treat especially persistent pain a lot more multidisciplinary, because it's a lot more complex, to be treating it like a chronic condition. So it needed everything thrown at it within rational reason. But it really required that holistic, comprehensive, project managing point of view, really, as opposed to the very quick fix that we were hoping to achieve, but we were just cycling.
Yep. And what kind of role do you think that pharmacists can play in persistent pain management?
Well, a whole lot. Everything from as simple as education, empowerment, validation of the patient. So just starting active listening is really, really useful, because the patient has been for so long feel like they've been misbelieved, and to be honest, I think they have been misbelieved. Let's own that problem that perhaps we've contributed to, and I know I myself probably have. I can imagine even with a pain experience myself, I'm sure I've contributed to that problem. And now starting at that viewpoint, educating them to the new science, and we've got to be very good at being able to articulate that, and I think that takes practice. To be able to get work your mouth around those words, because pain's such an age-old problem, and I tell you now, if we ask a pharmacist to explain pain, I reckon they'll get twisted and knotted and try and find their way around and almost confuse themselves. So I think it's really important for us to be able to process, in a very process-driven way, explain pain.
Yep. Beautiful.
Yeah.
And for those consumers or health consumers out there with persistent pain, how would you or what kind of tips would you give them to navigate the health system so they get the appropriate care?
Yeah, really hard, and as complex as their condition is, I believe it's as complex to land on the right people who will help them. Probably the biggest message is that they do not give up, and they do not assume that the one person who tells them that they cannot help them, that they're too hard, that they don't get stuck with that belief. It takes specialty skills to manage pain. And unfortunately, not all health professionals will. So if they land with those ones who have the best intentions in heart to help, but they simply don't have the knowledge, then they're going to get some very poor help. So on the other side, it's not easy to find sufficient healthcare professionals who are equipped. So it's a catch-22, which is why my work with PainWISE, I've been really trying to at least designate, over time, over years, pharmacists who at least I know have got some training in pain management. They've still got, room to move, room to grow, but at least here's some people who are not going to invalidate them at the very least, or at least they're going to be able to find resources to lead the patient somewhere. So I think, yes, it's hard. I probably don't have an easy answer to go, gee, where do you start? I think start with your local doctor if you can. If you can't, go to your local pharmacist. I think the message is just don't stop at a practitioner that's not right, Neither do you want to spend your money on every practitioner who tells you that they can fix your pain. I think there's the other side, right? I think you want to be mindful of that also. So pharmacists are really well equipped to objectively help the patient, I think, weigh up, should I go to the naturopath, should I go to the chiro, should I go to the physio? I think hopefully pharmacists can put themselves out as good resources for patients to be welcome to come in to at least help them weigh things up. Yeah. And I think hopefully we can do that role. Yeah.
Great. And you've been talking about neuropathic pain in particular and demystifying neuropathic pain. So could you tell us a bit more about that?
Yeah, so nerve pain has had some changes in its definition on an international level. We've discovered that true neuropathic pain, we used to lump everything into neuropathic pain, like everything that zinged and twanged and stung and, numbed. But to be really honest, it's not, we can't lump everything in there. There's more differentiation. So nerve pain is when there is damage to the nerve, put simply. There's got to be demyelination, there's got to be severance, there's got to be something that has occurred in that nerve that has created an injury to the nerve. That's neuropathic pain. And usually the diagnostic for that is nerve conduction test as the true diagnostic. But when things still zing and, pins and needles and numbness and all that occur without a damage, which we once called neuropathic pain, is now more nociplastic pain, where the nociceptors are really sensitive. So you get the similar, symptomology, but there's no damage, which means that the patients can heal quite well from nociplastic pain because it's a matter of changing it back. It's a matter of rewiring the neurons through movement, through medication, through confidence, through literacy, to correct that situation. So one is correctable, one is less correctable. But I think one of the things I want to say is that for so long, because we've misunderstood it, we've just treated neuropathic pain with things like the gabapentinoids, your pregabalins, and nociplastic pain will marginally benefit from it only. True neuropathic pain will love it and it'll resolve, well, to a certain livable extent. So I think we want to get that one right, and I'm trying to educate everybody in that.
Beautiful. And you've had a stellar career, and it's pretty much driven by, I think, your passion and your will and resilience. Do you have any tips out there for all of the ECPs or people thinking about getting into pharmacy?
Yeah. I'm learning all the time, actually, from ECPs, and I'm quite observational and quite reflective, and I've had many ECPs who I've mentored over time, many, which I've had. It's such a nice experience to be able to do that and contribute my knowledge back. I remember as a young pharmacist, I remember cleaning the shelves of a pharmacy, and yes, Joyce did clean shelves. I took pride in cleaning my shelves. A very old pharmacy. And I remember thinking how much I hated the job in doing that. But I remember thinking, one day when I have enough knowledge, I'm so going to be helping pharmacists or young pharmacists learn. So I remember that moment. Long of the short is that get a good mentor. ECPs need to have good mentors. If you haven't, go find one. Just keep asking, keep door knocking. To make sure you've got that support. I think it's not the knowledge that you need. Yeah, you need knowledge support as well, but that's available. But it's more that maturing. It's like maturing cheese, really. I'm a bit of an old cheese, let's just say. And I think it's trying to refine that, but you need someone to help you do that. So I think mentorship is a real need and gap, I believe.
Yep.
And I'm glad I can play that role informally, but it'd be lovely if there was a formal process in that's more than just your internship preceptor. You know, I think that's a certain type of mentorship, but I don't think there's any continuum beyond that. So I do feel that if ECPs can get mentoring well, then they've got someone to emulate, then they've got someone to help to inspire them, and then everyone's talented. I love to see the little talents bubble out of the ECPs as such. So so I think if you haven't already realised that you've got a talent, find a mentor that's going to help you discover that, and then find whatever that is and develop that, you know. Yeah,
great. Well, thank you for your time today.
That's all right.
It's wonderful speaking with you. And she's my mentor. No one can have her. Nobody.
I was gonna say-